Hi, my name is Mitch Misiak. I'm a physician assistant at Synergy Health Partners Orthopedic Urgent Care. Something we see commonly in this type of office setting revolves around injuries to the hand and wrist. So I wanted to take some time to discuss a few of the most common hand and wrist ailments to help inform our patients about what could be going on and how we diagnose and treat them. Whenever discussing orthopedic problems, it's common to separate them into two categories. One category is acute, as in this is new or recent and often involves trauma, versus chronic. Chronic's long-standing, it's slowly been getting worse for you over time, and it's not often related to trauma. Our common acute injuries to the upper extremity include wrist fractures, most commonly distal radius fractures, as well as hand and finger fractures. Oftentimes people have heard of a boxer's fracture when people have punched something or they have a blunt trauma to the hand. And then there's also finger dislocations, which are instantly visible and you notice a deformity after a trauma and they require prompt treatment. All these injuries require x-rays and usually some sort of immobilization. We commonly treat these with splints, DME like a removable brace, or a hard fiberglass cast if necessary. Based on the location and the severity of the fracture, sometimes advanced imaging or even surgery is needed to make sure the bones heal properly and does not cause long-term issues. On the flip side of this, we have many chronic hand and wrist ailments that can be painful for patients as well. These often include things like carpal tunnel, where you'll get numbness and tingling into the hand and fingers. It's often worse first thing in the morning and can wake you up at night. There's also trigger finger, where you notice catching or sticking in your finger, worse with range of motion. And then we often see tendonitis, which is common on the thumb side of the wrist, as well as either side of the elbow. This usually worsens over time and is due to repetitive motion type of activities. These types of hand and wrist disorders usually get worse over time, and some may have been nagging you for years, others maybe just a week or two. Either way, we treat them with the same approach, starting with conservative measures first, like bracing and either topical or oral anti-inflammatories, and then progress to injections or surgery based on the severity and level of discomfort. These are just a handful of the frequent hand and wrist conditions we see in our orthopedic urgent care facilities, but they are very common and can be easily treated if evaluated by a trained specialist. Don't let acute, severe injuries or long-standing chronic hand pain slow you down. Come and see us at Synergy Health Partners Orthopedic Urgent Care today.